Back on Morning Line. Thanks for joining us. Grace Smith and Jim Powers both with us this morning, taking your phone calls, talking about the situation for seniors, long-term care. Money's available to maybe help folks either stay in their homes or find a place to live as they age if they need help. Tennessee Coalition for Better Aging, very involved with that. Guys, we've got a few more phone calls here, so let's go to Angela next. Angela, good morning. Hi, Angela.
Hi, good morning.
Morning.
I just wanted to know if Tennessee has a program where they will train family members to take care of their loved ones and then pay them to keep them at home and help with their health care and give them the health care they need. I know PA has a program like that because my aunt is not 93 years old.
Wow.
And my cousin was actually trained by the state to take care of her in their home.
Oh, interesting. What do you think, guys? Because we're talking about the shortage of labor for this type of thing. Is there something along those lines here in Tennessee for family members? It seems like we've lost the audio there for a moment. All right. Grace, are you there? Let's see if we can hear you. I mean, the audio's down at the moment. Hang on. Okay, hang on. We're going to get that. There may be a technical issue. You guys are fine, but we'll see if we get the audio back up. I want to go back to get a little more background, at least from Angela, on that while we wait to get that audio. So, Angela, did you say this is happening in Pennsylvania?
Yes. They will actually train a family member, and then they will pay them as they would a healthcare worker to come in and take care of the family member. My aunt was fortunate because she actually lived in the same home with my cousin.
And she would prefer to stay in her home, right? She wants to stay in her home.
Yes, yes. She's 93. They still take care of her. Yeah.
That's awesome. Do you happen to know how long the training took, or what type of training it was, and how much they ended up? How much did they pay them? Do you know what the pay was like?
I have no idea, but I know my cousin who was working for a veterinarian, and she has 2 children. She was able to quit her job and maintain her, you know, financial status with her children on that salary. So I'm assuming it was comparable to what she was making. I am not sure on the details of that.
Okay, but the bottom line here is that it was a situation where they did not, or you did not have the means to bring in, say, an independent healthcare worker. This is a family member, because they were able to pay, was able to leave their job and then go live with her, or at least provide care for her. You said that they moved in with them?
Yes, they lived together. They did live together, yes, and they still do. But PA will actually take a family member. They applied for this program, and they will train them so they're able to take care of a loved one, and Pennsylvania will give them, I guess, an hourly salary to do that.
That's awesome. All right, let's see if we can get the audio up on our guests. Let's see if we've got your audio up now, and try it again. We may have corrected that technical problem. Go ahead, Grace, you first.
Well, I just want to thank Angela for bringing up that example. And that is something that the Coalition for Better Aging has recommended as a way to increase the workforce and support family caregivers who are providing care for their loved ones. I know my aunt quit her job in insurance years ago to move in with my grandparents as they were aging and as their health declined. She gave up her salary, but she also sacrificed additional Social Security earnings by quitting work. So we believe that it is a solution that we need to look at to reimburse family caregivers.
Now, is that something that state lawmakers would have to pass, you know, Dr. Powers or Grace? I mean, how does something like that happen?
Well, we know that Tennessee does not offer this program now, but that other states do. So, yes, it does take some state involvement. It does not necessarily have to be a legislative action. This could be a ruling, a 10-year ruling. But currently, although we remain in active discussion with state officials, it is not a program that is currently available in Tennessee.
Okay.
We know nationally there are about 40 million unpaid family caregivers who are doing exactly the sorts of things that Angela is talking about, that are not receiving any help with the care that they provide.
Yeah, what a great idea, though. I mean, it's the base, and we talk about basic care. That's something a family member doesn't necessarily have to have real specialized care. You can still have extra money, maybe to bring in a phlebotomist or someone if shots or blood needed to be drawn. But the basic stuff of just being there, helping them prepare meals, helping them if they need access to the restroom, things like that. Is that what we're talking about?
Yes, it is. It's hands-on care. These are things that family members often do out of love and out of necessity, but they often have to leave their own work in order to provide that. When a family member, loved one, needs 24-hour care, that is a very difficult job. So providing respite for the family care member and also to offset some of the wages that are lost are very important items that we would very much promote.
Yeah, and part of the issue here, whether there's a program like this or otherwise in Tennessee, here's the thing, Grace. There are people out there that are reaching that age now and need the help that don't have family around. Or they got a bunch of deadbeat family members that aren't interested in helping. Unfortunately, there's plenty of them out there as well. So what happens to them?
It's a great question, and you're absolutely right. And we need to note that there are nonprofit programs, there are services available through the area agencies on aging that receive funding from the Older Americans Act, from the federal government. It's important that we say that there is a network of services available, and usually the best place to start is to call an organization like ours, AgeWell, or to call your area agency on aging where you live. There's also a nationwide elder care locator that can help you identify services that are available across the country. So there are resources out there where you can get information. The challenge is oftentimes you have to meet certain income restrictions to qualify for services. And we are concerned, as other states are, about the broader, not just low-income individuals, but also the broader middle class who has worked hard but may not have the savings in order to pay private rates for an extended period of time. And so states like Minnesota are looking at private market solutions, looking at things like a low-cost term life insurance that converts to long-term care insurance. They're also looking at requiring Medicare supplement plans to offer home and community-based services. So we're studying what other states are doing and bringing that to the attention of our state leaders, saying, hey, we need to take a cue from some of these other models and look at a variety of solutions that can help here in Tennessee.
Let's take another call. We've got a call here from Drew. Hi, Drew. Are you there?
Yeah, hi. How are you, Nick?
Good. What's on your mind, Drew?
Well, we've got a state that's run by Republicans and politicians who've got top-of-the-line health care for their own family members, which is why they don't give a darn about the poor. Because why should they? Because when their family members need health care, they got top-of-the-line health care.
Well, I mean, you wonder, I mean, the politics involved in this. I think both of you, our guests, would argue that whether you happen to be wealthy or not, taking care of those who really need it is in society's best interest overall. I would think that benefits all of us if we know that there are people that are being cared for that don't end up destitute, that then end up having to need more expensive services even beyond that. Do you agree, Dr. Powers?
Yes, I certainly do. And I think it is important, though, to talk about income issues. You know that to qualify for TennCare right now, you have to meet the federal poverty guidelines. And for an individual, that's $17,609, or for a family of four, $26,200. So you've got to be very, very destitute. There is another program to actually expand our Medicaid program to cover people up to 138% of poverty. We know that people over 138% can qualify for the exchange program to get health insurance at a greatly reduced rate. But for those in the middle, the gap, which is about 350,000 people in Tennessee, between the federal poverty level and 138%, they have no help. They're really on their own. It's very unfortunate. I agree with Drew that we should provide health care really as a right, not as a privilege. And that involves helping those that have lower incomes.
You know, we talked a lot about in-home care, which I think is very important, and I know that was one of your points of reference this morning. But Grace, with regard to, nursing home facilities, the VA has, a facility where, veterans can obviously go to. A lot of them, do they not have, and Dr. Powers, you can weigh in as well, I mean, is there not a waiting line to get into some of these? And then at what point, do you have to pay? I think many of the folks in this line are waiting because they've become destitute and need a place to go, at which point Medicaid may or may not step in. But I mean, just getting into one of these facilities, and frankly, I've been to some, there's some very nice ones. There's some I have absolutely no interest in having a loved one living in. I mean, they're deplorable, frankly. So how do you decide, if you can get into one of these places when there's such a line? And is it true there's a waiting line for a lot of them?
There is.
Dr. Powers?
That's why we're promoting home and community-based services to try to keep people doing well in their own homes for as long as possible. When it comes time for nursing home care, you are correct. Unless you have an acute illness, such as requiring a hospitalization, it is a long process waiting to get into a long-term care facility. And although we have many of them in the Nashville area, families definitely are going to have preferences, and they need to visit and see which facilities they feel comfortable in. Because of COVID, we're aware that many facilities have had just extreme hiring problems. They pay very minimum wage for nurses' aides, and that's also something that this stimulus could help Tennessee with. We could provide bonuses and improve the retention of that long-term care workforce. We know that the better off the employees are at these facilities, the number of RNs that are employed, the greater number of highly skilled individuals, the much better the care.
And Nick, one other thing is that not all nursing homes accept Medicaid. And so that if you are looking for a nursing home, knowing that at some point your resources are going to run out, there's a limited number that accept Medicaid.
Right.
And so then it becomes harder to get into those.
Oh, boy, really hard. Like I said, with my folks, they're purposely in one that we looked into that is Medicaid qualified, but they've been paying for several years. The fact that they've been paying and they're already there is going to give them a leg up on anyone else from the outside looking in. If that's one trick to get into it.
And your parents, Nick, are your parents, your parents are in assisted living, I think is what you said.
Right, it's assisted living. It's not quite memory care, but they're meals. Right. They have, the nursing if they need it with their medications, and they've got an apartment that they share together in a set, like nursing home facility. And, in Boise, it's pretty good. The two of them right now, $6,500 a month for the two of them combined. That same thing here in Tennessee is going to cost you $12 grand. How does anyone afford that, if you can even get into that? Boise and Idaho has some of the lowest assisted living prices anywhere, which, that just happened to be lucky for them. But I don't understand how someone pays for that. I mean, I was going to ask you the costs for assisted living in one where meals and you've got care, and it's not even memory care, which is the highest level, and it's setting you back $8 grand a month per person. It's absurd. $8 grand. Who can pay that? Dr. Powers, can you pay that?
Yeah.
No, but I think you point out that the fact that the kind of services that your parents are getting are costly, and if family is providing that, that's all uncompensated care. And again, they do it out of love, but it stretches the resources of many families. We're aware of individuals who leave the workforce in order to provide care for their parents. and that's an added loss. It's just an unfortunate situation nationwide.
Well, and that's the thing that's weird to me, because, you know, guys, someone's getting rich here. Okay, I'm sorry. I know they're not paying maybe the nurses the money that they deserve, you know, Carol, but I mean, or Grace, rather. You know, when you're talking about 12 grand a month, you know, 8 grand a month, and that's a crowded facility with all the rooms taken care of. And you know what? There's not a whole lot that goes into it. The food's not great. It's decent. They play games and they watch TV, and then they've got staffers there for when issues come up. Why aren't they paying them more? There's someone corporate's making more money there than the nurses if they can't afford to pay them a living wage. But someone's making money here, right, Grace?
You're right. I mean, many of these facilities are for profit.
Oh, darn right.
You know, we don't know, you know, what they are reimbursing their staff, but I can tell you there's a lot of competition for those workers. And if they can make a dollar or two more an hour somewhere else, they're going to leave.
Yeah.
So, you know, the facilities that are high quality recognize the value of their staff, and they're going to do whatever they can to keep them there. So, you know, that's important. Workforce is critical.
Yeah, the competition maybe pushes the wages up, which is a good thing. Let's go to Turnbow. Turnbow, good morning. Hi, Turnbow.
Yes, I'm asking you this. Yeah, you're talking about the how much everything costs.
Yeah.
What about Obamacare? Have you ever thought about if the state expand Obamacare, it'll be better?
You mean from the healthcare aspect of things? Does that
from everything?
Okay, and I'm not real schooled on that. Can either of you comment? We talked earlier about TennCare with regard to Obamacare, the healthcare status. Does that have a role in this with some of these nursing home, you know, issues and then in-home healthcare?
Indeed, it does for care overall. You know, Tennessee is one of 12 states that has not decided to expand their Medicaid program. And right now, they are offering actually an added 5% federal increase. In other words, 95% or $95 for every 100 comes from the feds, 5 from Tennessee, in order to expand their Medicaid program, the TennCare program. There are 350,000 individuals in Tennessee that are caught in that coverage gap. They have zero health insurance, and that's just unfortunate. We know that states that have accepted the federal help, that was 90%. Now we can get 95%. Have much improved outcomes for for all the population, particularly as we were talking about for nursing home populations. They've had less deaths from COVID in nursing homes. They have fewer hospitalizations. They have better staff retention. And there are many good things about expanding the Medicaid program for Tennessee. That's something also that the Tennessee Coalition for Better Aging advocates for, and we've been in active discussion with state officials about these issues.
Listen, we're going to take a quick break. We'll be back with our final segment. When we come back, you two, if you would, I want to kind of just set the table for our viewers. If they're facing these situations, what they can do right now to start preparing for it, if there's things they can apply for, how you get set up so that you can deal with this before it becomes a crisis. We'll take a break and be back right after this.